Hello, and welcome to another CX Moment. In this series, we chat with companies about what's happening with their business, their support centers, and with their customer experience. If you want to catch up on any of our previous episodes, check out the Zendesk YouTube channel, and you can find our conversations with Slack, Stitch Fix, Box, and many others. I'm Sarah Reed from Zendesk, and today we're joined by Michael Pace from Virgin Pulse and Henry Falter from GoHealth. As you know, this 30 minutes is going to go by super fast, so ask your questions in the Q&A and we'll do our best to answer them all. You'll also see a very short poll about 5 minutes before the program ends, and take a moment to share your feedback, and we certainly appreciate it. So let's go ahead and get started. Hey, how are you both today?
Doing great, thank you.
Great, Sarah, good to be here.
It's good to see you. So Henry, tell us a little bit about your customers, just so we can set the stage of who they are, what their demographic is, and what do they come to GoHealth for?
Sure, yeah, so GoHealth is a technology-enabled insurance marketplace. So we service individuals who are in search of health insurance and work with a variety of different insurance carrier partners that are big national players and some regional players as well. To really have a kind of a fully integrated marketplace to allow our customers to shop with us and buy the right plan that's for them. Specifically, we really focus on the Medicare Advantage market, which is the 65 and plus market. And my role specifically is more focused on the customer service side of it, where once they enroll in a plan with us, I'm very focused on making sure that our customers are ready to use their plan and that we can help navigate their kind of plan journey.
And how exactly, since you own the support organization, how is your support team structured?
Yeah, so primarily are structured around the types of activities that they're doing. So we have some teams that are very focused on individual outreach telephonically. We have some teams that are more focused on chat and text response and stuff like that. And then we have teams that are kind of further segmented by site and by product. So Medicare Advantage, U65, and then we have 3 locations across the United States where we further segment into teams and groups.
And Michael, your customer base is very different than what GoHealth has. So walk us through who comes to you, what does Virgin Pulse exactly do, and how your teams are structured.
Sure, so here at Virgin Pulse, we are changing lives for good. We work with some of the most known companies and municipalities around the world. We help people within companies start creating great healthy habits, whether it's step challenges or getting your preventive care or making sure your biometrics are kind of going in the right direction and such. And we make it fun and we make it easy for companies to get involved and get their members involved or their associates involved who become our members. So we have members from I think 6 of the 7 continents around the world, actively taking steps and doing things to get rewarded and start building really healthy habits, whether it's nutritional or breaking some bad habits or just getting your steps in.
I feel like I have established some bad habits over the last couple of months. So, Zendesk, if you're listening, I could use a step challenge, please.
I know a program.
And your customer support organization, walk us through how you're structured.
Sure. So primarily we're helping out with a couple different things. So we're helping out with technical issues. So if they have a device or something along those lines, making sure they're syncing with the app, making sure they're getting rewarded for their steps or explaining the program, if they have any questions about it. And so they'll come into member services for those needs. And we have, we're also broken up mostly by channel, phone, email, and chat. We do a little bit of social. And we're located primarily when there is no COVID going on. We are primarily located in Providence, Rhode Island, Dallas, Texas. We have handfuls of folks all over the US and Bosnia. is our other office.
So what I like about pairing the two of you on this conversation today is, even though you're both technically in B2B spaces, both of your organizations, your support orgs, deal with the consumer, so the customer, which I think is very fascinating. And you are spread across multiple regions. Now we're definitely all distributed in a way we weren't before. So for everyone listening, even if you don't have a question, let me know the direction that you'd like this conversation to go, because both Henry and Michael have a vast range of experience. So ask us about contact center operations, employee engagement, customer retention, whatever direction you want this to take, we can go that direction. And so let us know in the Q&A. But until then, let's get back into that health and wellness, which you both brought up. And it's always been important, but why do you think health and wellness is bubbling up in so many conversations right now? Henry, do you want to take a stab at that?
Sure. Yeah, I think initially when we kind of saw the writing on the wall, we were not equipped to have a work from home workforce. That was something we always considered, but with COVID emerging, we really had to scramble and get everyone in an environment where they could work from home. I joke that I think that we single-handedly disrupted the global laptop supply chain because we had so many orders in. But so the initial phase is really about like just scrambling to get things, people working from home, right? And then it became about, okay, how can we get production to look the same way we did in the office, but always thinking that there is a light at the end of the tunnel. When we go back into the office, things will be back to normal. And so maybe some of the bad habits that start emerging at home, things like that, you don't really think of them as much. We're at a place now where it's been less about, when we go back, but if we go back. And so I think some of the things that we've kind of put on the shelf in terms of, is my work environment okay? Is there a bunch of noise where I work? Am I alone? Do I have the right healthy habits and the right routine? Those are the types of things that now are starting to bubble up and I think are becoming really important as there's still all this anxiety and uncertainty in the world we live in. And so we spent a lot of time, and I know Michael has too, thinking about some of the messaging that we wanted to put in place with our leaders and with our people, just to make sure that they know that we support them and that it's okay to not work your entire day. You can take breaks.
Right.
We can instill, try to instill some of the same culture infrastructure that we had while we're all in the office.
And Michael, your entire business premise is around getting employees to start moving health and wellness in the workplace. Are you seeing an uptick in requests to bring your services into companies now?
Oh, definitely. And we even have a new product out that actually will tell you if you're okay to go into the office and such. Oh. Pretty amazing. I'll show a quick picture of it in a second. But yeah, to kind of Henry's point, early on, so physical wellness and mental wellness, you're not going to be able to achieve any kind of level of strong customer experience without even that as a baseline, right? Mm-hmm. And where this was different, and as a contact center leader or customer service or operations leader, is we had to think of like the lowest points on the Maslow hierarchy of needs, right? I mean, those, when the call came in, it was about the safety of the 100 people out in front of me, or in Dallas or in Bosnia, and get them home as quickly as possible. Then it became like, all right, can they function? Henry was talking about laptops, right? Then are they productive enough, right? And are we just doing all the things that we could be doing? And then you start getting into, that top part of the pyramid, right? Self-actualization, stuff like that, how they're feeling. And I think what happened a lot was people were action, right? And kind of getting all into like what it's going to be like and how they were going to do it. And then we started settling in and it got tough, right? So, I'm not going to kid you. There was a couple days where, working from home, where it felt like I was, my activity, I think, was actually crawling to my laptop to go turn it on, right? Because, you start getting muddled. And we actually realized we needed let's just have a meeting and talk about like our personal challenges, even just to get us as a management team over the hump. And now we can start helping others. And we're really encouraging folks to, take advantage of the nutrition guides up with the program, or getting involved. We're doing a global step challenge now. I think we're 3/4 away around the world. My team is at this point, or take advantage of some of the meditation or yoga classes, or they do like a Zoom where people are all working out together and such. And no one needs to see this, but you can do that if you want. But there is this piece of, you're not going to be able to deliver great customer experience unless you yourself are well and healthy. And you need all those, like I talked about, you need to make sure you're in a good sheltered place, safe place, not worrying about all these other things going on.
That is such a great point, that if you're not in the right space, that you won't be able to provide the best customer service. And I think that is something that we all have to keep reminding ourselves and our teams. We have this question that's come in from Joanna, and she says that many of her agents now have a different working schedule. So it's less about being in that 9 to 5, or that block that we used to schedule, because of all the other things that are also going on in our personal lives. And so it's challenging to do those traditional scheduling. So how do you ensure that your customer needs are being met in a timely way while also accommodating adjusted, flexible working schedules?
Henry, you want to take the first?
Sure, yeah, no problem. So that's something that we've run into a lot. I mean, while schools were still kind of in session, we were sending people home. That was a tough thing with people who had kids at home and had to take care of them. And that's still a reality that we're facing now. We've really taken that into account, and we've adjusted schedules on our end, and staggered schedules quite a bit. We're also in a phase where we're hiring quite a bit to backfill any gaps in schedules. And so I think it's a hard problem to solve, but we've been able to solve it by just listening to both our customers and our agents as well. And
I just a little plug there. I heard you say you're hiring.
Yes.
That's a remarkable thing in this climate. And I know there's a lot of individuals who are in a place where they're also looking to perhaps pivot into customer support. Yep. One of the sessions that we did recently was with Time Shift, and it was all about pivoting into support as a career. So GoHealth is hiring.
Yep, absolutely.
All right, we do have a lot of questions, and I want to make sure I'm getting to a few of these. So there's a lot of questions around how has your support changed since COVID-19? So whether it's, have you changed your channels? Have you changed the direction in which you're proactively reaching out to customers? What has changed so that customers still feel you're listening to them, you are responding? Michael, you want to take that one?
Yeah, sure. I think from a general operations standpoint, not much has changed in that way. I think we realized we needed to change how we interact with the members. So just the term of sort of empathy and thinking about, their situations is incredibly important right now, right? So, even if I just look at my direct management team, I have somebody who's single, but his family lives hundreds of miles away. He hasn't seen anybody in like 4 months, right? Or like, I'm sure many of the people on this call, they have the 2 and the 4-year-old running around right now, and they're trying to listen to the webinar and take care of the 2 kids at the same time. And then you add on top of that, we've had 3.3 million cases of COVID in the country, and 140,000 people passing away. There's a lot going on in people's lives, right? So, and if for some reason they're concerned about getting their steps in or their rewards or something like that, while sometimes it doesn't seem like a gigantic priority in the grand scheme of things, if it's one less thing that they have to worry about or can aid them financially, because sometimes, it can impact
there's a reward.
Insurance payments, right? We want to really, really be, it's not like we're not always empathetic, but we want to, make sure we're really assuming the positive intent, right? And that we are taking the step back and, not understanding what everything else that's going on in this, member's life possibly.
Mhm.
Let's just take care of this thing for them, and go forward from there.
It feels like there's also a lot more of the anecdotal feedback that we're having to pull in from both our customers and from our employees. And Henry, talk to me about how you are measuring that sentiment, and how do you know when your agents need to be more empathetic, or that your customers are perhaps a little bit more stressed out or concerned than they used to be?
Yeah, and for us, I mean, the example was very specific and tangible, because our customers, and especially the elderly population, they had to react very quickly to a changing environment, because they were frequent users of their healthcare. So folks that went to the doctor or saw their specialist frequently, or went to go get their prescriptions, they started to get really nervous about how to use their healthcare in an environment in which they couldn't go see their doctor anymore, or couldn't go to the pharmacy. And so we did a lot of proactive outreach, but also got a lot of inbound inquiries about, how do I use telemedicine? How do I set it up? How do I get mail order pharmacy delivered to my house? And so we were able to kind of quickly transition or pivot our messaging to talk a lot about that, and to really help our members utilize a virtual healthcare environment, which can be difficult if you haven't used it before, even for someone who understands smart technology really well. For our agents, we do a variety of different things. We do frequent kind of surveys of kind of satisfaction. We hold regular, kind of to Michael's point earlier, we hold regular office hours and kind of team meetings where we just talk about highlights and lowlights of the day. And we try to keep it kind of interesting from a cultural perspective. We've rolled out culture calendars where people can participate, national pajama, you can wear your pajamas a certain day and you take a picture, or there's a fitness schedule where if you can take a picture of yourself doing push-ups or walking, the top earners of the culture calendar get time off, or they get kind of special exemption for certain things. So we're trying to keep it interesting, kind of internally, but externally. A lot of the focus has been about how to use your healthcare virtually, which has been interesting to navigate.
And as your customers are having these new challenges, and this question's for both of you, how are you then getting those trends back out to your agents, to your front line, so that they know how to best respond?
So is the question, how are we taking the sort of voice of the customer and kind of bringing it back?
Exactly. As you're noticing those trends and you start to see things change, with whether it's sentiment or the type of customer questions, how do you get that back to your agents?
Yeah, so I think we leverage a combination of a lot of analytics, both from like our telephony system and our case management system of Zendesk, to kind of provide, to bring in the data specifically to kind of understand what to kind of focus on. We do a lot of work with looking at disposition codes and the tags that are associated with things to understand, are these changing and are they not? Obviously, we also use the thumbs up, thumbs down, and kind of comments and satisfaction as well, and just kind of understand where it's going. Now, I think early on we saw more things with people concerned that they weren't going to be able to complete their program because of the current environment. Like sometimes people's programs require a preventative visit to their doctor,
which they couldn't do in the early.
Couldn't do.
Right.
So, like, how do we adjust for that? And sometimes it's adjusting with that client or sponsor and helping them understand, like, how do they want to do it so we could better serve, their particular, associates and members. But then also too, as we've, I want to say, I was going to say flatlined or flattened the curve, but we haven't really done that yet. But as we've gotten used to this or been in this environment a little bit longer, we're getting a little bit back to kind of some of the normal things that are coming up. But we definitely use the heck out of the explore button.
Well, and that's really good to hear, because there are some questions coming in around analytics and Explore in particular. And, how do you use them to create these data-driven decisions and balance out the sentiment with the data? So, and for anyone who is interested, we have a national user group next Tuesday. You can find that on our Zendesk events website, and it's all about Explore. And so we're going to dive into that in a lot of detail. So if you are interested, please go there. Just a little shameless plug.
And don't forget your self-service tools, and this is my new soapbox around here. I'm sorry. Your self-service tools are an incredibly strong voice of your customer. It's what they're looking for, right? So just because you don't get a human contact, they're still looking for help with something, right? And your self-service tools, and hope you have a knowledge base and leverage your FAQs and all that kind of stuff, both internally and externally. But you'd be surprised. We actually have a pretty big difference of what people call us about and what
they go and look for,
right? So in lots of ways, sometimes I feel really good and proud that our FAQs are handling that, but then also want to make sure, we understand why they're calling us or chatting us or emailing us in those spaces.
Henry, what do you use for your help center knowledge base? And does your customer base want to self-serve, or are they more prone to picking up that phone?
I would say that our demographic, you remember 65 plus demographic, as the 65 plus people start to age in, they're more and more tech savvy, but the current folks are definitely a little bit more technology adverse. And so we are exploring who the right kind of demographic is to have an online help center, to really focus on chat, to have a mobile application. But right now it's predominantly the biggest thing, the most proactive thing we did was just put our phone number everywhere. We talked about the point of sale. We put it in our receipt emails, we put it in our welcome kit, and that's what the more places you can put that for our business and get it in their hands, the more likely they are to leverage it. But again, it needs to be a lasting and valuable experience for them for you to call again, right? So did they have a good experience with that agent? Were their questions answered? Were they set up to succeed at the point of sale? For us is a big thing, right? Did we sell them something that they're going to be able to use, or are we stuck apologizing? Is a big thing as well. But I think as the next kind of year or so, we'll really start to find out if building out an online knowledge base will be useful for our members, which we're doing through Zendesk, by the way. So another plug.
Thank you for doing that. And Michael, I am going to push. Michael is very active on social, and Matt Foley, you've asked this question about. Matt is a support agent who just moved into the admin role for Zendesk. Okay. And he has some very specific questions around creating a help center. So my recommendation is to reach out to Michael on social, ask him how to create a help center, and he will give you the steps in which to do that.
Be happy to.
But I want to go back quickly, Henry, to what you were just talking about, and it's that selling the right thing to your customer at that point in time. And we have a question that's come in around retention and whether or not you've perhaps shifted your focus from upsells, which I would expect is a pretty big part of your business, to more of the retention side of things, in light of the economic situation that many people are finding themselves in right now.
Yeah, we've definitely bolstered our retention resources and want to, I think what we found is that if we sell someone the right plan, we can get them to retain the plan, right? And with our business, there really is a right answer for every person and every health insurance product. Like there is a match. And so we think we can create that match because we have the product suite. And then it's really about setting the right expectations for what's going to happen next. We find that a lot of people cancel early on because we just didn't set the right expectations with them about when they're going to get the materials, when they can start using their plan. And so we realize now that it's probably a little disingenuous and just not a good business strategy to really focus on cross-selling or upselling. So we'd rather focus on existing customer support. And again, a lot of the conversations have become way more tactical around, oh my God, how do I use my plan? I've used it this certain way for years and I've been a loyal member, but now I can't see the doctor I've been seeing every month for a certain treatment or certain thing I need to see. So we've really focused on peer support, answering questions, getting the right answers to questions, and work with our kind of carrier partners to facilitate that too.
It's an interesting adaptation, and we at Zendesk are finding ourselves in a very similar situation where we had this incredibly extensive roadmap of products and solutions that we were headed towards, But once the pandemic hit, you recognize that the most important thing is supporting the customers that you currently have. And it's really looking at what it is that they need right now. And so we've had to go back and reevaluate our entire roadmap and look at, what's best for them now. So it's where I think a lot of companies are in a similar place as that. All right, we are running out of time. As I told you, this 30 minutes would go really fast. So there's a couple things that I do want to touch on. Michael, if you could give just 2 tactical and low-cost things that you would recommend every leader focus on right now, what are those?
Yeah, so first thing, I'd probably just put them both right in communication at this point. I think doing more things over video that could be recorded, and especially call center folks, you want something recorded, kind of an update on what's going on internally, a little bit externally, what's going on with the business, those kind of things, what's going on with your department holistically. Do more of those things, do it on Zoom or whatever, and just record it and kind of send it out. I'd also say, in terms of communication, Henry mentioned it before, as leaders, and this is also good just for your own sanity too, block off 2 hours, at some point and call them office hours, right? And these are just times of the day that anybody in your organization can book, as long, book it, and whether it's an agent or someone on your operations team or whatever, and they can just kind of bring it, whether it's career questions or, personal wellness questions or anything that they want to talk about, make yourself available. Uncertainty is very, this whole time is uncertain.
Right.
Try to make, your controllables as certain as possible. And I do think, normally you can go out into the floor and be present. You have to be present differently now at times.
I like that. Videos, and those videos can be emailed, they can go out on Slack, they can go out on social, however your agents want to see those, whatever your intranet might even look like. Put those videos out there and do them often. That's a great bit of suggestion, and I like the office hours. Henry, anything you want to add to that?
Yeah, those are great examples, Michael. I think turn your camera on if you're a leader. Turn your camera on if you're talking to your people. Communication is gotten harder in this environment. And I think you'll find that if you force yourself and your people to turn their cameras on and actually engage in discussion, the discussions will go better. I've heard people say that, oh, I didn't shower today, or I got stuff in the background, and my response is usually like, well, the way you look right now or the way you feel right now, like, would you show up to work that way? And do you think your customers you'll be delivering a good experience to your customers or a poor one based on how you feel and kind of how you spent your day preparing so far. So that's a big one for me that I've really pushed. The other one is there are some really low cost ways to bring more social engagement back into your team's environment, right? I know GoHealth is still a very social company that kind of thrived on that camaraderie. And I think there's really easy, low cost things to do. We have a cool series called Chat and Chew that we do every Thursday, where we pair people up and they just talk, and we expense lunch and we do stuff like that. And it doesn't cost any money to institute a culture calendar where you're having people engage in something that makes it fun to kind of and enjoyable to be a part of a team.
I like that. Those are great suggestions. And in our last minute, before we go, what's one Zendesk tip or trick that's really helped you, whether it's that's helped your employees or helped your customers, that you'd like to share? Henry?
Yeah, we're pretty new in our scale with Zendesk. So we've been using the sandbox a lot to download new extensions and try out new workflows to try things out before we put them in production. It eliminates the amount of egregious mistakes that we make in terms of when we put things in production. And I think we found a lot of cool plugins and different types of workflows that we can use with the sandbox.
Excellent.
Our side, we built a whole team called our e-services team that exclusively focuses on digital help. So whether it's FAQs internally, externally, leveraging the knowledge capture kind of app within Zendesk. And then obviously, we get a ton of that goes into aiding our bot usage and all kinds of other stuff. It's invest in your self-service. It's so worth it.
I appreciate that. And with that, that is it for today. And so I want to say a big thank you to Henry and Michael for sharing your expertise. And thank you to everyone for sharing a moment with us today. Please stay connected with us and the rest of our Zendesk community. We're going to take a little break over the next couple of weeks, but you can actually catch our CX moment conversation with Shopify in one of our breakout sessions for an upcoming virtual experience that we'll have. It's called Let's Talk Change, and that is happening on August 11th at 9 a.m. So please go ahead and register for that. And as I mentioned, if you're interested to learn more and explore, we also have our national user event happening next Tuesday. So with that, thank you again, Michael and Henry. Be safe, be helpful, and we'll chat again soon. Bye, everybody.
Thanks, everyone.